Welcome to the truth about laser therapy, presented by Dr. Rappe. I assume you're watching this today because you saw an advertorial in the paper about high-powered laser therapies and how Dr. Rappe brought laser therapy to the Coachella Valley. Okay, so we're going to talk a little bit about that. I'm going to talk about some functional medicine. We're going to talk about, maybe I'll throw in some stuff about spinal decompression, but the main conversation today is going to be about laser therapy and the truth, because there is some misinformation going on, floating around out there. So first and foremost, I think it's important that you know who is your lecturer. My name is Rappe. I'm the presenter today, and I received my doctorate degree in chiropractic in 1989, and since that time I've traveled the country extensively, meeting and training with other doctors that use high-powered laser in their offices. There's a huge difference between high-powered laser or a class 4 laser and a class 3 laser, and we're going to talk about that as we go along. I also have postgraduate studies in functional endocrinology, functional nutrition, functional wellness, functional metabolic testing, and functional blood chemistries. And the reason is because I believe that the whole body needs to work together as a system, and I need to evaluate you and understand you as a whole, not just one particular system by itself. So we're going to get right into this high-powered laser therapy section. Here's the next section you can see. What does laser mean? Light amplification by stimulated emission of radiation. That's what laser stands for. So it's a light form. Okay, laser therapies in healthcare. Therapeutic lasers are used for the stimulation of cell function. The biological effect is photochemical, not thermal or heat, as you would see in the case of a surgical laser. Surgical lasers create high-intensity heat so it can destroy tissue or cut through tissue. Even though the majority of our patients in our office have failed everything that traditional insurance-based medicine offers, our success rate approaches 80 to 90%. The introduction of the AVI SL30, as pictured here, is the world's most powerful therapeutic laser. And as I've mentioned earlier, I am the only practitioner in the Coachella Valley who has this particular laser. If in fact you'd like to seek this laser somewhere else, you'd have to drive into LA an hour to 2 hours away in order to receive services. The conditions that we treat with laser in our office include, but are not limited to, the following: peripheral neuropathy, disc bulges, disc herniations, stenosis, neck and back pain, rotator cuff injuries, carpal tunnel, pinched nerves, arthritis, knee pain, and post-surgical recovery. Who's using high-powered lasers? I'll tell you who's using high-powered lasers. Dr. Rappe is the only doctor in the Coachella Valley providing high-powered laser therapy. However, there are over 400 other providers across the country that use high-powered laser technology, including the medical staffs of NFL teams, Major League Baseball, National Basketball Association, and college sports teams, the United States military and veteran hospitals, as well as veterinarians, equine, and small animals. I will say this, that I have treated many different professional athletes, from professional tennis players, professional golfers, and you'll see a picture here of one of my professional football players. In addition to that, Special Forces, Navy SEALs, Green Berets, Army Rangers, and SOCOM practitioners as well. Here's a picture of James Dockery, who's an NFL defensive back. He is currently playing for the Carolina Panthers. And here's a picture of him in the office, and he receives pre- and post-season treatment. Preseason, I get him ready, and postseason, he's so beat up that I have to get him back into shape again before he goes back. And he's received treatment for a number of years and has had amazing results. The summary of laser therapy biological effects are pretty straightforward. The accelerated tissue repair and cell growth, fast wound healing, reduced fibrotic tissue formation, anti-inflammatory effect, analgesic effect, improved vascular activity, increased vascular supply, lymphatic drainage, increased metabolic activity, and improved, this one's important, improved nerve function. The biological goals of laser therapy. High-powered laser therapy aims to biostimulate injured and dysfunctional tissues deep inside the body at the site of injury. It works at a cellular level to biostimulate the body's natural physiology and therefore speeding the healing process. With over 3,000 studies that have been done, the following are the biological or beneficial effects of light therapy on tissues and cells. Common cause of neuropathy. This is the common cause. We typically see this in the office. Spinal issues. Sometimes spinal issues can cause neuropathy symptoms, including degenerative disc disease, herniated disc, bulging disc, spinal stenosis, radiculopathy, sciatica, neuritis, and the list goes on and on. Statin drugs is another one. Statin drugs are really bad. The side effects are horrible, and I see these in the office all the time. Patients present with signs of neuropathy, and they're taking statin drugs. Cancer treatment and cancer therapy. Many times, chemotherapy will deplete the body of certain nutrients. That brings on the onsets of neuropathy. Diabetes. Diabetes, the classic from diabetes is decreased vascularization. Vascular supply to the extremities, alcoholism, autoimmune conditions, and nutritional deficiencies. Current treatments for neuropathy, typically drug therapies is what you see. You go to your doctor, you have neuropathy, he doesn't know what's wrong with you, he's not sure, he's tried all kinds of pain medications, nothing has worked. Finally, he tries Lyrica, Neurontin, Cymbalta. They all have terrible side effects. Or he'll refer you to a pain management specialist that'll do the same. And or the pain management specialist will get frustrated and eventually will send you to a neurologist who will run lots of expensive tests, and he'll say something like, well, it could be sort of, kind of, maybe, not sure, and he'll really never give you a definitive answer as to what's wrong. He'll say, oh, you've got some kind of neuropathy, but he can't tell you why, and he'll tell you to keep taking drugs. There's other modalities out there, medical devices that are being used that are proven they don't work. LED lights, you'll see they'll strap a pads of LED lights on you and tell you how they're going to stimulate this and that, and they really don't. You see them using that today in fat removal from the belly. They don't work. What they do is cause you to sweat and lose weight, so you're going to lose water weight. Typical medical advice that most of my clients get when they come see me is that my doctor finally gave up and just said, you're going to have to live with it. And I think that's a travesty. And the reason I believe that and think that way is because the newest modalities available out there are high-powered laser therapies. I've been using them for years in my office, and we get amazing results. The effect of high-powered laser therapy on neuropathy pain, specifically neuropathy pain. High-powered laser will stimulate new capillary formation and thus increasing circulation and bringing nutrient-rich blood into the affected tissues. It's very important to understand this is the only modality that will do that. We relieve inflammation around the damaged nerves, provide an analgesic effect to the area, and stimulate cellular repair and rejuvenation of the damaged or irritated nerve tissue. The best example I can give you is if you have a wilted plant at home, you don't just throw it out. First thing you're going to do is give it water and see if that'll help. If that doesn't help, the second thing you're going to do is what? You're going to put it in the sunlight. That may help as well. And lastly, what you do is give it nutrients. So what we do in my office is we attack neuropathy looking at the body as a whole. First, we want to apply light. That would be the laser light. Okay? That's going to increase in nutrient-rich blood flow. That's water. So now we have light and water. So we increase the nutrient-rich blood flow into the area, and then we directly stimulate the nerves deep inside the body to rejuvenate them and bring them back to light. That's the light. This modality is the only modality or therapy out there that can reach the deep nerves of the body that are affected by neuropathy. Okay, I want everybody to understand that. And lastly, what I do in my office that nobody else does is I want to look at you from a metabolic standpoint. Let's just take a look and see if there are any other things out there that are causing this or creating this or allowing this environment to exist in your body. Maybe it's the dietary habits. Maybe there's supplementations, herbs, vitamins, nutrients, nutraceuticals, homeopathics that you're not taking that would facilitate the body to respond better and heal. So I want to look at a metabolic picture as well, and that's something I do that no one else does. The penetration depth of a class 4 laser, if we were to look at the comparison, a class 3 laser is really, it's like that little gadget the guy uses at the lectures where he's got the little red dot on the screen and everybody follows a little red dot around. That's a class 3 laser. The penetration depth of a class 3 laser is about the layer of skin. It will not penetrate beyond the layers of skin. Therefore, it's typically only going to be beneficial in a very superficial manner or superficial problem that you present with. The class 4 laser, the one I use, the most powerful laser on the market, the AVI SL30 class 4 laser, it's a 30-watt laser. We're going to get 7 inches, at least 7 inches of penetration depth. That's where the deepest nerves are located. The ones that are really affected by neuropathy are the deepest nerves inside the lower extremity. In this particular case, we're talking about the legs. We're going to get 7 inches deep of penetration. But what else is very interesting about this laser is that the beam expands out into a cone shape as it penetrates in the body. No other laser on the market does that. Therefore, it gives us deep inside the body where all of the damaged tissue is, along the bone or the deepest nerves, a larger surface area of treatment. So as we use the wand to treat the nerve, we're also treating surrounding tissues as well. And that's what this particular diagram shows, the difference. Here's an additional picture that shows class 3 lasers that will only penetrate about the layers of skin compared to a class 4 that will penetrate 7 inches deep. And you can see the difference in these two, how important it is that we get maximum depth of penetration when it comes to healing power with a high-powered laser. If we're talking about nerves from the spine and the low back, the only way to get through all the paraspinal muscles, the supporting structures, the fascia, ligaments, and tendons surrounding the nerves is to have sufficient high power and penetration, and this is the only laser in the Coachella Valley that'll do that. And that's what helps us to achieve the phenomenal success rate that we have in our office. Current treatments for neuromuscular skeletal pain is, again, out there, you got drug therapies. You know, when your doctor says, well, here, take this pill and take it every single day. I mean, we're not really affecting the underlying cause. They're just shutting off your symptoms. Steroidal or non-steroidal anti-inflammatory medications, antidepressants, and anticonvulsants. Injections, epidural facets, and trigger points. Epidural injections have proven to be absolutely useless with regards to the underlying cause of anybody's pain. The problem is they cover up the symptom. They negate the pain signal so that we don't feel pain, and it's not correcting the underlying problem. Physical medicine, chiropractic, massage, and physical therapy. I've been providing chiropractic care in my office for the last 25 years and have had phenomenal results with many, many, many cases. Very few people who have entered my office who have received physical therapy have really received any benefit whatsoever. Look at surgeries. 74% of all surgeries fail. Post-surgical candidates that I see in my office all the time with what's called failed back surgery. That's the last thing that a person should ever do is cut on the body. Once they've undergone the knife, their body will never, ever be the same. So I see lots and lots of cases in my office where they've been told you need surgery, and I say, thank goodness you came to me first. Let's try this and see if this is going to work for you. Non-surgical spinal decompression. Excuse me. Non-surgical spinal decompression is a tremendous modality that we can use. I use it in my office. I'm the only one in the Coachella Valley who is certified, who took postgraduate studies in non-surgical spinal decompression through a gentleman named Jay Kennedy. I'm a certified spinal decompression practitioner. So it's a tremendous tool, and I've saved lots of people from going under the knife. And lastly, high-powered laser therapy. It's the only treatment that actively or actually biostimulates the accelerated healing of living tissue. Let me say that again. It is the only treatment modality out there, the only tool that actually biostimulates the accelerated healing of living tissue. No other modality does that. Clinical translation of high-powered laser therapy that affects your low back pain. Decreases inflammation of the spine and the nerve roots, and also decreases the inflammation of the pain receptors. increases microcirculation of structures leading to the reduction of swelling around the joints and other structures, accelerates healing of bone, cartilage, tendon, ligaments, muscle, and skin. Just an example of healing of bone, I had a young lady in a couple years ago who broke a bone in her foot, and on x-ray it was obvious that it was broken. It was clear on the x-ray that it was broken. We did some intensive high-powered laser therapy on her, and in 3 weeks the bone was completely healed in an x-ray comparison, and she was able to take part in the McCallum Theater end of the year production. Decreased formation of scar tissue is huge, especially with post-surgical cases. When people develop scar tissue, that leads to long-term issues, and it decreases or even eliminates the need for invasive procedures. As I mentioned earlier, we've kept many patients from having surgery. Why is the new 30-watt high-powered laser so effective? I mentioned this earlier. The ability to deliver large amounts of therapeutic energy deep inside the body. The ability to penetrate deeper than any other possible modality. The ability to treat large surface areas. This is very important with disc problems, neuropathy, back and neck pain, because these conditions are usually widespread areas that need to be penetrated and or the surface areas that need to be covered. Lastly, the AVI SL30 is the most powerful laser and with the most advanced therapeutic laser in the world, and it's also safe. So let me go back to penetration again. There's no other modality in the Coachella Valley that can penetrate deep enough into the tissues to directly affect the deep nerves of the lower extremity inside, underneath the calf muscles that are the cause of most people's neuropathies. Okay? That's the bottom line. The penetration depth that we get with our laser is surpassed by none. So it's important that you understand that. Conditions that we treat with laser, I mentioned this earlier, we're going to go over it again. Disc bulges, stenosis, peripheral neuropathy, neck and back pain, rotator cuff injuries, carpal tunnel, pinched nerves, arthritis, knee pain, and post-surgical recovery. If what you've heard so far makes sense, you can contact my office at 760-777-4177 to set up a consultation. What makes us so different? What makes us so different is I, Dr. Rappe, I have 25 years of experience, clinical experience, as well as in research. I've been using lasers since I got out of school in 1989 and got my doctorate degree. I've traveled the country extensively getting postgraduate studies. I have a postgraduate certification in functional wellness and functional medicine. It's very important to understand that knowledge is powerful. What makes Dr. Rappe so different? Dr. Rappe also, myself, I also use what are called proprietary high-powered laser protocols. These have been developed over 25 years of experience in presenting or providing thousands upon thousands of treatments to patients, and then utilizing those results to tweak and modify my laser protocols to now I finally have what really works for people. Including that is honesty, integrity, and results. I take great pride in the honesty, integrity, and the results that I achieve with the clients that I take on. I've been at this for 25 years, and I've turned away many cases where I did not believe that they would help, that the laser would help them. And so I take great pride in picking and choosing those cases that I believe I can help. Ask yourself the following questions. What would life be like if I were able to reduce or resolve my pain? These are important questions for many reasons, and we'll get to that in a second. How often or how has the pain affected my life, my relationships, my ability to work, my ability to have fun and enjoy life? Many of the clients that I see in my office are retirees who've worked really hard to get to a certain place and retire, and they find that there are many things that they would like to do that they can't do because they have pain. And therefore, it's important for them to ask themselves, how has pain affected their life? Lastly, on a scale of 1 to 10, how motivated am I to reduce or resolve my pain? This might sound like a funny question, but this is probably the most important question here. Why? Because I have a concierge practice. I only have so much time in my office with clients, and I spend a lot of time with them. Therefore, I only want to take those clients who really, truly, honestly want to get better. If you're a 7, 8, 9, or a 10, then you're somebody that I'm interested in working with. You're somebody who I'm interested in working with that I believe will step up to the plate and do everything necessary to resolve their pain. That's why I ask these questions. Okay? What's next? Well, what's next is really important. The key is you have to qualify for laser therapy in my office. Again, I mentioned earlier, I do not take all cases in my office, and so there's a qualification process. You're going to contact my office at 760-777-4177, and my staff will direct you to my website where you can download all of the forms and paperwork necessary to receive a consultation in my office. I do a high-powered laser treatment candidate evaluation, and here's the qualification process. Let me go over it with you. First, you need to have a consultation with Dr. Rappe to discuss the problem. I'm going to answer all of your questions. I will thoroughly explain the program as well as my specialized treatment protocols. 2, we need to complete a laser qualification case history and questionnaire to determine if I can help you. And if I cannot help you, if I truly believe that this is not going to work for you, I will not accept your case, and I will make that clear to you up front and tell you. 3, you need to complete the laser dietary and nutrition evaluation. On my website, you're going to download some forms. They're going to say metabolic assessment forms. Here, I will spend the time to analyze your dietary habits, which may or may not contribute to your neuropathy. I will determine if you need to make any adjustments. Additionally, I will also personally evaluate your supplements, herbs, minerals, homeopaths, etc. in order to determine if they are beneficial to you or hindering your prognosis. Lastly, I'd like you to bring your most recent blood work, whatever you have, if you have any. That will help me determine if there are anything else on your blood work that you were not aware of. I look at blood work from a completely different standpoint than your typical allopath. I use what are called functional medicine lab ranges. They're much narrower ranges, and they tell us when something bad is about to happen, so we don't wait and see. We take pro-action right now. So it's really important, if you have blood work, bring it so I can review it to see if there's anything that's inhibiting your prognosis. After we've gone through all of that, the consultation, I will then determine what length of treatment would be appropriate for you. I will tell you this, I'm the most conservative doctor in the Valley. I believe in providing you with a length of treatment that will provide you the information necessary to do more treatment. In other words, if we do a certain length of treatment and you get great improvement, we can always add more on the end of it. Lastly, after I've presented the length of treatment, I'll put together what's called a plan of action. This is where I'm going to outline exactly what we're going to do. In some individuals' cases, it includes nutraceuticals they need to take, certain dietary changes that have to be made. I will not change your medications. That's not my job. That's something that you will continue to do with your medical doctor. At this point, if you choose to move forward with the program, and I've decided that I can help you and I will take you on as a case, we will then discuss any financial considerations that would allow you to start a high-powered laser therapy program in my office immediately. Does that sound fair? I want to make sure you're fully educated before we move forward. At this point in time, let me tell you this. This consultation, with the amount of time that I'm going to spend reviewing all of your paperwork and your blood work and your nutraceuticals and whatnot, it's going to take me some time. I have a fee for that. The total fee for that consultation is $250. However, because you've taken the time today to listen to this and watch this PowerPoint, and I've educated you and you've stepped up to the plate, I believe that you're ready to move forward. I believe that you're ready to contact my office, set up a consultation, and that you want to move forward so that we can change your life. We can possibly turn your neuropathy around. So what I've done is I've reduced that $250 fee to $50. So your investment today is $50. Contact my office. My staff will direct you to my website. You can download the paperwork, fill it out completely. Take the time to answer all the questions. When you come into my office and I see just big circles over 10 different questions, I know you're not serious, and so I'm not going to be happy. Fill the paperwork out, bring me some blood work, and let's just sit down and see if this is the right place for you. Okay? So I appreciate you taking the time to listen to this. Your investment today is going to be $50. I highly recommend, if what I've said today makes sense to you, okay, knowing that I'm the only trained laser therapist in the Valley, knowing that I'm the only doctor in the Coachella Valley that has a high-powered laser therapy device, the latest, the 30-watt AVI high-powered laser therapy, knowing that this particular laser is the only modality out there powerful enough to penetrate deep inside the tissues to stimulate the nerves that are causing your neuropathy, knowing the honesty and the integrity of 25 years in business, that I will turn you away if I don't believe I can help you. I will tell you up front. Knowing all of this information, I can only say, call now and make an appointment. Okay? 760-777-4177. Limited space available. Remember, I only take a certain number of clients because I'm a very, very busy doctor. Again, call now and make an appointment. 760-777-4177. Limited space is available. Thank you very much, and I look forward to seeing you in the office, and hopefully I can help you turn your neuropathy around.